The patient's view on early detection and screening for prostate cancer is that it is a necessity. We have to move there. We have in Belgium every year 9,000 new diagnoses, and of these 10 to 15% are metastatic at first detection. Otherwise, 1,500 men die in this country each year of prostate cancer, and that is not good. That has to come down. On prostate cancer screening, we take the stance that we want a risk-based system of screening, meaning that patients with a very low PSA, they don't need to come back the next year or the next 5 years, whereas patients with a higher PSA probably have to come back next year or something like that. In the system we use in Belgium, we do not rely only on PSA. We do, of course, other tests. More precisely, we go for the MRI before the first biopsy. And this leads us to have a 75% positive detection of cancers at biopsy, which is extremely high and which may make us think that some cancers are missed. And in these 75%, of course, we have a third low risk. They go to active surveillance. We have a third high risk and even metastatic. They have to be treated, and we have the rest intermediary risk, where we will evaluate what to do. And for patients, it's important that they have been taken into management. They have to be taken care of. And not doing the simple PSA test for us is a little bit negligence of the rights of the patients to know. If they don't want to know, of course, that's no issue. Don't have to test them. They will see what comes. But for those who are informed and want to know their PSA, it is an obligation to do so. There is criticism on PSA use and on early detection because we come from a past where PSA was, let's say, a little bit abused, especially in USA, for instance, where any increase in PSA led to prostatectomy. This is, of course, not a good system. In Europe, there was much more resilience. We were much more reticent to go from PSA test to a treatment. We did other things in between, and we were very critical of doing biopsies. Since 10 years, the percent of positive biopsies in Belgium is increasing, and we started even above 50%. In breast cancer, it is still 30-35%, which is a completely different figure. But taking a biopsy from a breast is something else than taking a biopsy from a prostate.